we will discuss about GIR, Glucose Infusion Rate, how to calculate glucose infusion rate, and made a custom percentage of fluid from two different type of concentration. From the very childhood, we are doing the mixing, like making a custom fluid with a color coding. When we are drawing the watercolor, mixing red and blue, creating purple, like that glucose infusion rate calculation and mixing a custom fluid is so much simple. So we will learn how to do that in a simplest way possible. And we will learn why there is 6 in the hourly calculation and why there is 144 in the denominator of daily calculation of fluid. At first, we have to know what is glucose infusion rate, or in short, GIR. Glucose infusion rate means how much of milligram of sugar delivered to our bodies per kg per minute. Because in the body there is minute by minute metabolism of sugar is done. So GIR means milligram per kg per minute. Now in our hospital, machinery works in liters and hours. But baby's biology runs in milligram and minutes. So our formula are just translators between these two. Let's assume this fluid contains 1% of dextrose. This 1% concentration means 1 gram of sugar per 100 ml of fluid. So 1000 milligram per 100 ml. Now cleaning up the fractions, we remain with 10 milligram per ml of fluid. So 1% concentration means 10 milligram per ml of that IV fluid. So we all know that IV pump delivered fluids in ml per hour, but babies metabolize glucoses by minutes. To convert the pump's hour into baby's minute, we must divide the equation by 60. It is as simple as that. 1 hour equal to 60 minutes. Now we assemble our master hourly equation. How? We all know GIR equals to NQ per kg per minute. So we all know that 1% of dextrose equals to 10 milligram per ml. So our total milligram of glucose or dextrose equal to percentage of dextrose into 10 into total IV fluid. Now let's put in into our milligram position. Total IV fluid will be written as ml per hour. Concentration is written here and PN is written here. This is the total milligram of glucose given to the baby. Now kilogram remains as it is. This is the total milligram, and in the GIR formula there is mg per kg per minute, but we are giving fluid in hours. So 1 hour equal to 60 minutes. In place of minute, we will be calculating and multiplying it with 60. The final hourly fluid calculation formula: IV fluid rate into ml per hour into percentage of dextrose divided by 6 into body weight into kg. This is the GIR calculation formula in the hourly rate of fluid. So ml per hour, to convert it into per day, we have to multiply with 24 and per kg body weight. So ml per kg per 24 hours, ml per kg per 24 hours. this means ml per kg per day into body weight divided by 24. That means ml per hour equals to that. We came with the formula of ml per kg per day into concentration. 6 into 24 equals to 144. So our final daily formula is here. ml per kg per day with concentration by 144. Someone's write it as ml per kg per day into concentration of fluid into 0.007. That means 1 by 44 is equal to 0.007. This is the final GIR formula. If we are adjusting the IV fluid as ml per hour, our GIR formula will be ml per hour into concentration by 6 into body weight. Perfect for rapid bedside pump adjustment. And if we are planning for TPN of fluid as a total daily fluid, we are using ml per kg per day. Then our GIR calculation will be ml per kg per day into concentration divided by 144. Someone may write it as in a short ml per kg per day into percentage of fluid concentration into 0.007. As a summary, if we have to jot it down from very first in a blank sheet from our memory, so glucose infusion rate means how much milligram of glucose given to a baby per kg per minute, mg per kg per minute, as baby's metabolism done in milligram and in the minute to minute format. We all know the percentage concentration of a IV fluid means 1% of dextrose means 1 gram of sugar in 100 ml of that IV fluid. That means 1000 milligram per 100 ml equals to 10 milligram per ml of that 1% of dextrose fluid. So total milligram of glucose in any percentage of IV fluid means that concentration of the fluid into 10 and how much ml of fluid given. Suppose we are giving 1 ml of 1% dextrose, that means 1 into 10 into 1, that is 10 milligram. What we have calculated here, 10 milligram per ml. Now here our formula, total milligram equals to percentage concentration of the fluid into 10 milligram and how much amount ml of fluid given. In the denominator, per kg per minute. Now we are focusing into the pump. We are giving fluid as ml per hour. So 1 hour equals to 60 minutes. So if we are writing it as ml per hour, we have to multiply the denominator with 60. That means percentage into ml per hour into body weight into 6. If we are converting it into ml per kg per day, then we have to write it as ml per kg per day. 6 into 24, that is equal to ml per kg per day into percentage concentration of fluid by 144, that is also equal to ml per kg per day into percentage of IV fluid into 0.007. That is all. The holiday said are good. For a 10 kg child, we are giving maintenance fluid is 100 ml per kg per day. Maintenance fluid. So how much GIR we are giving as a maintenance fluid? Ml per kg per day into concentration of fluid into 0.007. If we are giving plain DNS, that means 5% dextrose. 100 into 5 into 0.007, that means 3.5. And if we are giving maintenance as a 10% dextrose, then it will be 100 into 10 into 0.007, that's 7. Actually, more or less 4 is the GIR we are giving as a maintenance fluid. That will suffice our metabolism and maintain normoglycemia in the patients in the normal ward. But in case of why we are using this conversion formula to learn in the simplest way, to maintain euglycemia in the critical care patients where metabolism is not normal as a ward patient. There may be hypoglycemia and we have to increase the GIR as per the need. And if the glucose CBG is in the higher side, we have to decrease the GIR of our fluid accordingly. Now we are coming into the custom fluid mixing part. From this formula, we can derive the percentage of dextrose as GIR into 6 into body weight divided by rate in ml per hour. Now why we have to calculate the percentage of dextrose here? Why we have to calculate the percentage of dextrose? Because in the peripheral IV line, maximum 12.5% of dextrose can be given. Higher percentage of dextrose as higher osmolarity. This higher concentration will cause vein irritation, severe thrombophlebitis. Sometimes from this hypertonic fluid, the extravasation chance increases and the extravasated tissues may cause tissue necrosis. In the peripheral veins, there is slow venous flow. So if we are giving the higher concentration, it cannot dilute the concentrated sugar very fast. So if we have to give more than 12.5% of dextrose to maintain a specific GIR, we have to give it via central line. That is why we have to calculate the percentage of dextrose in a specific GIR. Percent concentration of sugar like DNS, half DNS, 5% dextrose, isolate, P, plain. And what about the 10% dextrose fluid? Plain 10D and isolate P4 and 4. And for higher concentration, we have 25% dextrose. For all other purposes, we have to mix this 5%, 10% or 25% fluid to prepare a custom mix fluid. Now understand a very basic math. This is a seesaw. The lever not in the central position. If we put both sides equal weight, which side will go down? This side or this side? This side will go down. But if the lever is in the central position, equal weight on both sides will keep the lever in the horizontal plane. This is a very simple basic math. We all know from our childhood. We have 5% and 25%. So what will be the center? 5 minus 25, that is 20, divided by 2, 10. 15% is the center. So if you have to prepare a 15% concentration fluid, you have to mix half of 25% fluid and half of 5% fluid. That will create a 5%, 15% mixture. Suppose you have to prepare 100 ml of 15% concentrated fluid. You have 5% dextrose here and 25% dextrose here. The mid position of these two is 15%. 25 minus 5 equal to 20. 20 by 2 equals to 10. So 5 to 15, 10. 15 to 25, 10. The part is half and half. So if you mix 50 ml, half part of total as 5% dextrose and 50 ml of 25% dextrose, you can prepare the custom fluid of 100 ml of 15% dextrose. This is the easier formula. Suppose you have to create 12.5% dextrose. So lower concentration we have the 5% and higher concentration we have 25%. We have to mix these two. Which part and how much we have to mix it? We have to calculate it. 12.5 minus 5 equal to 7.5. And 25 minus 12.5 means 12.5. So total distance is 20 part. Here the midpoint is 15%. But we have to create a concentration of 12.5%. So this is on the lower side. So we have to mix small amount of higher concentration fluid and large amount of smaller amount of fluid. That will create a lower concentration. So we have to mix smaller part of higher concentration and a higher part of smaller concentration. Suppose you have to prepare 100 ml of 12.5% dextrose. Then you have to mix this part of 25% dextrose plus in part of the remaining part as 5% dextrose. It equals to 37.5 ml of 25% dextrose and remaining 100 minus 37.5 ml of 5% dextrose. It means this part will be 62.5 ml of 5% dextrose. So we have to mix large amount of 5% dextrose here, that is 62.5 ml, and a smaller amount of 25% dextrose, that is 37.5 ml of 25% dextrose, to prepare 100 ml of 12.5% dextrose. So it is clear. To simplify this and to make it easier day-to-day calculation, we have Pearson formula. What is it? We have to write high percentage. Let us assume our example here. We have to mix 12.5% dextrose. Our higher concentration is 25 and lower concentration is 5% dextrose. So high percentage 25, target percentage 12.5, low percentage 5. There is part high, there is part low. So you have to write it like that. Percentage high, part high, target percentage. Percentage low, part low. And subtract diagonally. That means high percentage 25 minus target 12.5 equals to part low. That is 12.5 part low. So we have 12.5 part of total as 5% dextrose. And subtract diagonally once more. That means target 12.5 minus percent low 5 equal to 7.5 part high. That means 7.5 part of our 25% dextrose. So the final formula, as we have calculated, 100 ml of 12.5% dextrose mixing needs how much of 5% dextrose? 12.5 part. That means 12.5 by 12.5 plus 7.5 into 100 ml of 5% dextrose plus 7.5 part 7.5 of 25% dextrose. So showing our actual formula we have calculated previously, 62.5 ml of 5% dextrose plus 37.5 ml of 25% dextrose. It is all the seesaw we have created previously. 25 part, this higher concentration, this is lower concentration, and mix. This is the actual Pearson Square formula. It is easier to remember, and you can create all the mix from this formula. For term and children, we can give normal maintenance as 4 to 6 mg per kg per minute, and the preterm we may require up to 8 mg per kg per minute, and in critical patient we have to increase up to 12 to 15 mg per kg per minute GIR. So then we have to know the concentration of dextrose, how much rate you have to give, and if it is given in the peripheral vein or central vein, you have to decide accordingly. So this is all.